A stroke patient arrives at a hospital. An AI reads the brain scan before any human does, alerts the specialist directly, and treatment starts 31 minutes sooner. In the trial that measured this, those patients were 40% less likely to be disabled 90 days later. Because in medicine, the machines arrived, and almost everyone won. First, understand how fast this happened. A decade ago, the US regulator, the FDA, had approved 6 AI-enabled medical devices. Now it clears over 200 a year. Today, more than 1,400 AI medical devices are authorized, and around 3/4 of them read medical images. 3 in 4 American health systems now run at least one AI application, up by 1/4 in a single year. 2/3 of physicians already use AI at work, a figure that nearly doubled in a single year. Quietly, in the background, AI became standard equipment in medicine. But here's the surprise. The biggest revolution isn't in diagnosis. It's in paperwork. Doctors have spent up to 2 hours on documentation for every hour with patients, and it has been burning them out for decades. Enter the ambient AI scribe. It listens to the consultation and writes the clinical note before the doctor leaves the room. This is now the fastest-growing technology in healthcare. One product alone is used by over 600 healthcare organizations. Another is deployed across 200 health systems, including the Mayo Clinic and Johns Hopkins. And randomized trials, the gold standard of evidence, show it works. Documentation time cut by around 30 minutes per doctor per day. In one study of 263 clinicians, burnout fell from 52% to 39% in 30 days. And the economics are brutal in the right direction. A human scribe costs up to $65,000 a year. The AI, as little as $100 a month. Now, diagnosis. This is where the numbers get genuinely remarkable and genuinely nuanced. On narrow, well-defined tasks, AI now matches or beats specialists. In a landmark Swedish trial published in Nature Medicine, AI-supported breast screening detected 17.6% more cancers than standard practice, while cutting radiologist reading time by up to 90%. One newly cleared system reads body CT scans for 14 different conditions with 97% sensitivity. A pathology AI for prostate cancer hits 99% and cuts diagnosis time by 2/3. These are not demos. These are approved systems catching real cancers in real hospitals right now. But here is the honest other half. Ask a general-purpose AI chatbot an open-ended diagnostic question, the way a real patient presents, messy and unclear, and across 83 studies it averaged just 52%, roughly the level of a non-specialist clinician. Fewer than 1 in 5 health systems say they have achieved reliable AI use in core clinical diagnosis. So the pattern is clear. AI is superhuman at looking for a specific thing. It is still mediocre at working out what's wrong with you. That difference is why your doctor still has a job, and why the doctors using AI are quietly becoming better than the doctors who aren't. And that brings us to the deepest reason medicine is different from every industry we've covered. In tech, in law, in finance, AI arrived into industries with too many workers. Medicine is the opposite. The World Health Organization projects a global shortfall of around 10 million health workers. Half the world lacks access to basic care. Britain, America, India, everywhere. The waiting lists are the story. When AI absorbs work in an industry with a labor surplus, people lose jobs. When it absorbs work in an industry with a massive labor shortage, patients gain access. Same technology, opposite outcome. The difference was never the AI. It was the maths of supply and demand underneath. There's money confirming all of this. The AI healthcare market sits around $40 billion today, projected towards $600 billion within a decade. Health systems report about $3.20 back for every dollar invested in AI, with payback in months, not years. And remember radiology, the specialty everyone said AI would kill first? A famous AI pioneer literally said, "Stop training radiologists." Radiologist employment went up. Vacancies are at record highs. The machines read the scans, and the humans became more valuable, not less. It remains the single best warning against believing confident AI predictions, including the scary ones. The caveats, because facts cut both ways. AI models trained on skewed data can be less accurate for underrepresented groups, and regulators are still catching up with algorithms that change after approval. Patients are moving faster than the system too, with roughly 1 in 6 adults now consulting AI chatbots for health advice every month, often with that 52% tool, not the 97% one. The gap between the AI in your hospital and the AI in your pocket is currently the most dangerous gap in medicine. So, to sum up, AI is now standard equipment in medicine. It reads scans better than humans on narrow tasks, it caught 17% more cancers in trials, and it gave doctors half an hour of their day back by killing the paperwork. But open-ended diagnosis, judgment, and care still belong to humans. And with 10 million health workers missing worldwide, doctors are not going anywhere. Medicine is what AI adoption looks like when it goes right. The machines took the paperwork and kept the people. If you want to know how AI is reshaping everything else, subscribe.